when you discuss pain, there's really three categories of pain that we see walk in our doors. You have acute pain. This is the individual who just rolled their ankle, they sprained their back shoveling, right? A muscle strain. Then you have more chronic pain or neuropathic pain. So this might be that person that has pain from like diabetes, right? Or they have numbness and tingling all over their body from really irritated nerves. Then you have another category of pain called centrally mediated pain. These are the patients that we see that come in who have Parkinson's disease, or they have multiple sclerosis, or those really, really bad autoimmune type diseases, right, that we think of. So there's really three categories of pain. And when you look at CBD oil, either topically or orally, it addresses, or there's areas of research to show that it can address each of those aspects of pain. So for us, in our clinic, we work with a wide range of patients. Your simple sprain strain all the way to your patient who has full-blown MS and who needs all types of rehab, right? So for us, the CBD oil was a great fit. Now, overall, I can tell you, like, day-to-day with the pain cream, that's a no-brainer. For those sprain strain injuries, for the golf season's going to be around the corner here in Buffalo, not too far from now, golfer's elbow, tennis elbow, we put the cream on the skin topically, and I'll tell you, it's within 5 minutes. By the time they're leaving, they're asking me if I sell it, if they can purchase it from me. And I experienced similar results. I play golf a lot. I had bilateral, epicondylitis, and within 5 minutes, the pain was almost completely gone. And the duration of relief that my patients report, 5 hours, 6 hours, it's really a lot longer than some of the other products that I see on the market that people are trying. We started using it with patients in that micro to standard dose, anywhere from 10 to 100 milligrams. And these fibromyalgia patients were coming in saying, hey, listen, I tweaked my back, but I noticed my whole body didn't flare up. Or if it did, that flare up seemed to be a much shorter duration of time. And when you look at the research, there's a lot of literature to explain why these patients are reporting those really fantastic results. I was excited when we started using it. Selling supplements for 9 years, people would come back and I would say, how did it work? How are you feeling? And they'd say, I think I'm better. I think I notice a difference. With the CBD oil, when it works for people, they're saying it without a doubt. They're saying, no, this is making a change. This is changing how I feel. I'm sleeping better. I have less pain. I have less anxiety. So that for us was just a great thing to see. Let's say we have that fibromyalgia patient with back pain, but really their whole body hurts. They get flare-ups. Right now, if our listeners have any familiarity with fibromyalgia, and I think this goes for most patients who are in pain, typically they're suffering from insomnia because the pain keeps them up at night. Now, of course, if you're not sleeping, your muscles aren't recovering, so you're going to have more pain. Eventually, that's going to lead to some depression, right? Now, perhaps the same patient has recently become unemployed due to discomfort day to day. Of course, that's going to result in some anxiety. And God forbid, maybe they've developed an addiction in the meantime, perhaps to opioids, something else. Even over-the-counter medication, we see it where people are hooked on Aleve, Tylenol, acetaminophen, things like that, right? So just taking that into account, your typical pain patient usually does suffer from insomnia, anxiety, depression, and pain, of course, right? Those are the top things. So when I speak to a patient, I tell them, listen, we're going to give you this CBD oil for pain control to help with the pain. But you have to be aware it might impact your insomnia. It might impact the depression. It might lessen the anxiety. And we tell them to start at a really low dose for that reason, because the effects of a full spectrum CBD oil are so broad, right? So we usually start patients at a lower dosage. We'll usually start around 10 to 20 milligrams, depending on the condition. And then we'll have them start to work their way up. We'll usually do a week at, let's say, 20 to 40 milligrams for the first week, once or twice a day. And then I'll ask them, I'll follow up with them. How are you feeling? Are you noticing a difference? And they're saying, I'm sleeping better. I'm not sure I'm feeling less pain, but my sleep is definitely better. And I think my mood is better too. I seem to have a lot more energy during the day, right? And I say, that's excellent. That means it's working. It's having an impact. Now let's see if we can tweak that dosage to positively benefit the pain that you're feeling, right? To reduce that pain. So then we'll start to creep up on the dosage a little bit. And usually we'll double it. If they were doing 20 milligrams, we'll bump them up to 40. If they were doing 40, we'll bump them up to 80. And we'll go all the way up to about, I'd say in my offices, we don't have many people using over 200 milligrams a day. I would say that's rare if we do, but we'll just slowly work it up. But I can tell you, it's really that beginning conversation with them saying, this takes time to work. This takes time to build up in your body. And I'd be more than happy to have that discussion, how it works with you guys today, but we really try and educate them on how CBD oil works in the body, right? So we tell them, your body makes its own cannabinoids. And one of the theories behind fibromyalgia is that these patients have lower levels of endocannabinoids, cannabinoids made from within, all ready to start. So we tell them, listen, we have to build up this dosage to get your body's endocannabinoids increased. And I say that might take time. That might take trial and error.